Hello and welcome to CXO Agenda 2026 by CXO TV, where we speak with senior leaders who are shaping the future of business, technology, and digital transformation. Today, we are delighted to have with us Mr. Bhoopendra Solanki, Chief Information Officer, Sakra World Hospital. Healthcare is one of the sectors where technology is no longer just a support function. It is directly linked to patient experience, clinical efficiency, operational resilience, data security, and the overall quality of care. So, today we will discuss how healthcare organizations are aligning technology with business outcomes, how AI and automation are entering the hospital ecosystem, and what the road ahead looks like for healthcare technology leaders. Mr. Solanki, thank you so much for joining us. It's a pleasure to have you on CXO TV.
Thank you, Ms. Kalpana, once again to bring me on your world-renowned platform. So it's a pleasure, me too, as well, to put our thoughts for the peers and industry benefit and patient journey, all those aspects. So, hello everyone, I am Bhoopendra Solanki, CIO for Sakra World Hospital. Yes, as you said, truly, Ms. Kalpana, IT is not a support function these days. It's a business enabler, we can say. If we talk about like 10 years ago, really in healthcare specifically, IT is a support function and not much weightage we are getting in terms of new technology enablement. Whatever going on, we have to maintain that. But somewhere 2016-17 it got accelerated, and then the COVID put this super fuel to accelerate the transformation towards the patient experience, internal efficiency, predictive analysis, and decision support system for the clinicians and nurses, all those areas. So now IT playing an important role in the business growth or experience excellence in each organization, and specifically healthcare as well.
Yeah. So it's not just only about efficiency now, it is directly impacting the patient trust, speed of service, and care delivery. Yeah.
Correct, correct.
So when you say technology has become important, could you give one practical example? Like, for instance, has the biggest impact been seen in patient experience, or it is internal workflows, clinical systems, or decision making?
Yeah. Time to time we evaluate the our digital journey towards the three main function. Like one is patient-centric experience, second is the internal staff, and third is the decision support system for the clinicians. In this aspect, this management decided to bring some robot. So now we have a four robot in different area like rehab, ortho, cardiac, all those areas. But we enabled closely the EMR function, because if you have data in digitized form, then it will help to the prompt response, prompt action, and predictive analysis, all those things. So what we did, we bring the new age HIS and implemented the EMR for OPD and IPD, both segment. IPD we almost reached to 100%, where doctor is prescribing everything in the system and nurses taking the action against that prescribed medicine and prescribed diagnostics we called MAR chart. Based on that they are taking the input and medicine getting delivered automatically, because doctor prescribed and then it is hitting to the pharmacy delivering to the bedside, and nurses taking care. So huge workload reduced from the nurses. Earlier also doctor were sometimes saying to the nurses, sometimes saying to the junior, or writing on the paper. But these days we enabled in the mobile app, and they are carrying that mobile app to each patient visit, and then defining the clinical care then and there. What exactly happened based on that, like there is a critical component in the clinical care, muse score. If muse score is 4, then we are sending trigger, because we have a data in the digital form, so we are sending to the nurses, please take care of this patient, muse score is, means that is a critical parameters going to the higher side. If it is 7, then we are sending to critical care, means that treating doctor as well, so he has to take care of his patient. So the preciseness coming with the help of technology. It is not like we are replacing doctor, we are replacing nurses, reducing the head count. No, not at all possible in the healthcare industry, because we are serving the human, not the machines kind of. So human touch is required whenever patient care is there, but we are making easy and prompt action, enabling the things in doctors handset, so that they can take the decision quickly and give the impact. So due to that, many critical patient got cured, like their journey is too weak. But this preciseness or predictive analysis we are giving to the doctor, now somewhere 10 days, 8 days, 6 days they are getting discharged and going to home, and then they are very happy. And then many patient wrote the feedback as well for the positive outcome of the technology and clinical care.
Yeah. So that's how, why Sakra is known as one of the progressive healthcare institute, especially when it comes to the technology adoption. Yeah. So
Thank you so much.
yeah. So if you have to identify top three technology priorities for healthcare organizations today, what would they be? Would you say it as AI, cybersecurity, EMR or HIMS, modernization of data integration? Is it automation, cloud, or business continuity?
Uh, Business continuity, yes, definitely, because earlier business running in healthcare, a combination of both IT plus manual document and then registers, all those things. But now completely moved to the digital technology, so that business continuity IT only can provide. Otherwise, if like in our case, everything going on through the system, if system is down for 4 to 5 hours, then how we will serve the patient, how will come to know the previous record, and then what medication is going on, how will come to know. So all those such scenarios is there. So if business continuity you will not keep in mind, you will not sustain. So business continuity require a good infrastructure underlying, and then cyber security also, because the walls around your system should be secure. Yes, you can't maintain 100%, but at least reach to 98, 99%, so that risk can mitigate almost to zero. And third thing is like cloud and other things. Yes, that's based on the your requirement. If you have capable team, or your organization permits, then keep the things on prem, because something goes wrong with the cloud, or something goes wrong with the connectivity from the cloud to the your organization, then how you will serve the patient? If it is in a house, then either connectivity is there or not, you will serve the patient still. So those things CIO along with the management have to decide which side they have to go. But definitely IT is the business continuity things which everybody has to recognize and work towards to bring the business continuity.
Yeah, so that's the most urgent for hospitals today.
Correct.
Yeah. And which one is more of a long-term strategic priority for you?
See, we go stepwise. So first is sustainable infrastructure in terms of server side, in terms of end user asset side. After that, if it is everything is fine, then you will talk about how you will digitize your data wherever the input source are there. Second layer is digitizing the data. Once it is digitized, then long term goal is utilize that data in terms of research, in terms of predictive analysis, in terms of compliance, in terms of training purpose. All those things we are working now. We are consolidating our data, and then bring the BI tool to utilize that data for the long term goal, because
So
data
data
is the fuel.
integration. Yeah, data integration is, I think, the second most important thing. Yeah.
Correct.
So a lot of people talk about AI at a high level, but in your view, where can hospitals start first without overcomplicating it? Like, for example, can AI first help in administration, patient support, reporting, scheduling, or decision support?
Yes, because AI in healthcare is still getting matured or evolving, we can say. So we are not touching the clinical portion first. We are exploring or doing the piloting in the non-clinical area, like this call center thing. A patient is calling for the appointment or for the report, sometimes for some other query, like hospital is open for the OPD, or do you have this specialty treating, all those queries. So this we are looking, like AI bot, AI agent can take care initially. If that agent is failed to respond, then transfer to the real agent. So that area. So this way we are looking. Second is clinical area, where second layer is doctor only, physical doctor. First layer is based on AI and based on the image, like X-ray. I'm giving one example. Once we technician taken the X-ray getting annotated by the AI and marking the spots wherever issues are there, and then drafting the report based on those annotations. That report and annotation going to the real doctor consultant in radiology, radiologist, and then he's having one glance and seeing everything is fine and finalizing the report. Earlier it takes 5 to 10 minutes, now it's taking less than 1 minute. So that way technology is helping. So two area, one we already implemented in radiology, second we are piloting like call center side. So AI is transforming everywhere, but we have to keep in mind, because nature of business, we are in the business like serving the patient, serving the human body, and then human touch also require, where AI can't help as of now. Later maybe something will come. And the second is operations like housekeeping, biomedical, engineering, all those area we are bringing the like ML, bot, AI things to make the processes efficient.
Yeah, so it's all about augmenting the capabilities of the clinicians, and of course, agentic AI is something which is, I think, much in use now, in trend for managing the calls. Yeah.
Correct, correct.
So, healthcare, as we discuss a bit on the business continuity, is in always on environment. Systems cannot afford long downtimes. And so,
Correct.
how important are backup, disaster recovery, and rapid recovery planning for hospitals today?
Yeah, it's a very crucial. People these days talking only AI, and then it's a very important question, because backbone is not strong, then no AI going to work. Correct.
Yeah.
So in our case, what we did, we now Sakra is multi-location. So one of the location we made the disaster recovery segment, and real time it's getting replicate, and whatever critical servers are there, so those are replicating to there. Also the within a data center, on-prem data center, we are taking the backup to D2D, then it's going to tape second level. Third is we are taking air gap backup as well, because that D2D backup and tape drive, even DR site can be impacted based due to the ransomware. But if we are taking air gap backup, that will not going to impact. So that will our final stage of data restoration if something goes wrong. So this way we made the layer, so that we can run our services as a plan, under plan of the business continuity.
Yeah. So are you also having any annual or quarterly kind of cybersecurity audits being done to check the resilience from any third parties?
Yes, every 2 year we do the VAPT. Even this year also it's going on now, and whatever they recommend, we implement one by one. It is not like in one go we can, then huge financial burden also will come to the organization. So that we don't want. So one by one we are putting and increasing, enhancing our cyber security posture.
Yeah. So now the focus is not just data storage, but it is fast recovery and continuity both.
Correct, correct.
Okay. So probably it could be one last question, which is all about hybrid cloud and infrastructure modernization. So as hospitals adopt more digital platforms, patient apps, diagnostic systems, and connected workflows, How important is scalable infrastructure, hybrid cloud, and application modernization?
Yeah. Few we talk about like healthcare, so few application we called HIS, hospital information system, are monolithic and very old. They meant on the very old technology and difficult to scalable. Even you can't bring the API protocol on top of that, those database and old technology. So that application modernization is a need for these days, because you need a data to run any AI component within an organization, or you want to consume public AI. Then also you require infrastructure where you can access those availabilities of AI capability. Second is, in this segment, like either you are on on-prem or you are on public cloud, private cloud, or hybrid cloud, scalability is required. uh, your workload is unpredictable these days. If you are putting any AI engine, then huge surge is there in the resource segment. So if scalability is not there, then your AI component and other application will not going to work. It's a rolling and buffering, and outcome will not be adequate as function is required. So scalability definitely required. Like in our case, we have on-prem, but on-prem we have CI infrastructure, hyper-converged infrastructure, which is equivalent to cloud. Means like you are sending a mail, just increase the RAM, or create a one more server. Same way we can do within our on-prem data center. So that level you have to be make. Either you are keeping the things on-prem or you are moving to cloud. Both side, that scalability is required. Otherwise you will fail to move forward.
Yeah, in fact, reliability and flexibility, again, infrastructure has to support both.
True.
When it comes to the app side of it. Yeah. Sure. So, I think if you would like to give any kind of advice to your peers, what it would be?
uh, Not much, everybody knows, but still, uh, IT should not work in silos. Okay, IT here to support the business. So my suggestion here, we have to sit with the end user, understand the process, and then bring the technology accordingly. If we are finalizing any product based on the vendor input or just showcase and then putting to the end user, most of the cases it get failed, because end user is not aligned with the technology which you are putting in place. So that close sync is required to make it successful. Any project, if we are bringing in the IT, even these days end user also talking about AI. Even they not much know about the underlying layer, how it's going to work, and then blindly they are putting the things into the cloud. Means so many platform available for the AI, and they are even not worried about sensitive data they are putting or just general data they are putting. So all those things should not be done by the end user, and IT should work tightly aligned with the end user. Then every project will get successful.
Yeah, sure. So thank you so much, Mr. Solanki, for sharing such practical and valuable insights. What clearly comes out from this conversation is that healthcare technology is moving beyond simple digitization. It is now about patient experience, business technology alignment, AI readiness, cyber resilience, data integrations, operational continuity, and building future-ready healthcare organizations. So thank you once again for joining us on CXO Agenda 2026 by CXO TV. We truly appreciate your time and perspective. To our viewers, thank you for watching. Stay tuned to CXO TV for more leadership conversations with business and technology leaders shaping the future. Thank you.
Thank you, Ms. Kalpana. Thank you.
For more updates from CXO TV, please like and subscribe to our channel.